I'm Julia Walters, Communications Specialist with Kingman Regional Medical Center. You're watching our COVID-19 update series, keeping our community and staff informed about issues surrounding the pandemic. Today's video features Drs. Brent Bedke and Ryan Swapp, pathologists and co-medical directors of KRMC's clinical lab. First, we'll go to Sarah Schritter with today's numbers.
Thanks, Julia. As of today, we have tested 7,905 patients for COVID. We have had 437 cases positive and 7,280 cases are negative. We have 188 cases still pending today. Currently in-house, we have 4 patients on isolation related to COVID. 3 of those patients are positive and we have 1 rule out. Our total overall positive percentage rate right now is right at 6%. For the last 30 days, our positive percentage rate is 3.47%. We wanted to thank all of our staff who selflessly give themselves to help others. You are true heroes. Thank you for taking care of the health needs of our community.
Thank you, Sarah. Now we'll head to the lab to talk to Dr. Bedke and Dr. Swapp about the lab's role in dealing with COVID-19.
Well, with a new disease and as the pandemic unfolded, it became clear that we really needed a gold standard in terms of testing that would let us know who has the disease, who doesn't have the disease, and there was a lot of confusion, frankly, and the lab's role became kind of very important overnight.
So we, because of the pandemic, we want to be able to test our patient population here in Kingman, and so we brought in testing to do that. And so the tests we have available now can diagnose acute infection, as well as we have a serology test that can help diagnose a past infection.
Yeah, there's been a lot of confusion around testing. There's antibody testing, which is what Dr. Bedke mentioned earlier. This kind of tells you whether or not you've had an exposure to the disease. The test that almost everybody is using right now to diagnose acute infection is some variation of a PCR-based test. We have that here in Kingman. We have it in 2 different platforms. And we're hoping that we'll have more platforms in the near future. And this basically just tests, it's looking for viral RNA, and it's amplifying that RNA and letting us know whether or not it's present or not. If you have it there, that means that you've got the disease, you've had the infection, or you've had a recent acute infection and you still have some virus hanging around in your body. We use instrument-based tests here in the laboratory, so it's a more accurate test. It takes slightly longer to do, but even with that, we have 2 methodologies. We've got the Cepheid and the Panther. You want to talk about that a little bit?
Yeah, so the Cepheid instrument it's really good doing like single tests 1 at a time, and it can do it fast. So the Cepheid turnaround time is about 1 hour from when we get the swab to we put it on the machine to get a result. The Panther is really good at doing a lot of tests all at the same time. It takes about 4 or 5 hours to perform each one of those tests. And so we can do a lot of tests at the same time in about 4 to 5 hours. For the patients coming to the hospital need to stay here or to have surgery, we can get those results to them the same day. So those tests are only for patients who are being admitted or having a procedure. So patients who are not admitted to the hospital or as an inpatient, there's tests out there that take longer to perform that we also do here at Kingman Regional Medical Center. But as of right now, those tests take about, on average, 5 days to get back results. And those tests are sent to Mayo Clinic. Yeah, so the PCR test, we used a nasal swab. So that's where they put a swab up your nose to test for that. And then we also have an option for some of our patients to do an oral swab. And that's just like a strep test where they put a swab at the back of your throat. And so that's our PCR test, and that diagnoses the acute infection, like Ryan said. And then we have our serology test, which is a blood draw, and that looks for previous exposure or infection. No, so we're testing people with the nasal swab who are symptomatic, and patients who are coming here for procedure, we test with the oral pharyngeal swab.
So we have two platforms here in-house, and then additionally we send symptomatic outpatients that won't be admitted, we send those to Mayo Clinic.
Mm-hmm. So Ryan mentioned before the word sensitivity, and so when we talk about sensitivity of a test, that just basically means how good is the test to pick up the virus or the organism. And our test here that we have at Kingman Regional Medical Center is about 99% sensitive, which basically means that 99% of the time, if a person has the acute phase of the COVID, we can pick that up.
So on the Panther, we batch test twice a day. So, we run it a lot. And we've been able to keep up with the demand. The hardest part is actually that we don't have reagents. And what reagents are is basically the chemicals that are needed to perform the reaction. And everyone's on allocation, which means all the hospitals are only getting a certain number of tests. We only get a certain number, and then we have to try to use those in the wisest way possible for the community and for the hospital. So there has been some frustration among our fellow Kingmanites, how to get a test. If you're not being admitted to the hospital and you are symptomatic, really there are a few options. One option is to get a test through the hospital. That test will be sent to Mayo Clinic. And the turnaround time has been somewhere, it varies, but it can be like 3 to 5 days. Just the ones that were done on this last Friday came in on Monday. So that's helpful. But there's a limited number of tests, and that's also varied at different time points in the last couple of months. And we're just trying to test the people who are most vulnerable or who are delivering care to the most vulnerable patients. And then, the hospital still has to operate. So people still need surgeries. People still need to go to the operating room, and those tests need to be available for them. Hospitals nationwide are allocated a certain number of reagents. Again, the reagents are just the chemicals that go into the reaction to perform the test. And so we get a certain number of tests per week on each of those platforms. And we cross our fingers every week that we'll get those. And then we try to manage those as best we can. But unfortunately, you can't test everybody every time they want it. And so, that's still something that we struggle with nationwide. It's hard because sometimes we hear, for example, I remember early on listening to press conferences and saying there's going to be 1 million tests available like next week. And then, I'm not even sure what they were talking about. Like, that never really materialized. It's hard work every week to try to get our allocation and then to manage it. And that's a lot of what we do. And we wish there were more tests, but we have to live in reality. So.
Mm-hmm. As of right now, the demand for tests is outstripping the supply.
So serology testing is also known as antibody testing. And it basically can tell you whether or not your body's mounted an immune response to COVID or a disease. So nobody's really using antibody testing in a way that helps with policy or workflow or back to work or anything like that, at least not at this point. I guess where it's really helpful is in larger scale studies, population-based studies where you can tell how much herd immunity you have. So at a certain herd immunity basically means at a certain level, at some point in time, enough of your population has seen the disease that it doesn't spread so rapidly, and it kind of dies out after you get infected. You can't infect everybody else because they've already had it before, and that's how it's helpful. So KRMC is actually doing a serology study, and it will be interesting to see. They're doing it over a longitudinal study, so over a period of time, and we'll see how that turns out.
So, Ryan mentioned herd immunity. Right now, we don't have great studies or data that show that what percentage of the population here in Mojave County have had the disease. But part of what Ryan mentioned is a study that's taking place right now is to try to determine what percentage of the population has been exposed. And so we don't have good data as to how many people here have been exposed. There's some state data on the state website for COVID that for some of the serology tests shows about 8 to 10% of the population here in Mojave County have been infected. We're not close to herd immunity.
Yeah, herd immunity usually you need 60 or 70% of your population to really, for herd immunity to work, and we're nowhere close to that right now. One thing that I think is helpful for people to realize is that our hospital's done really well in terms of testing. Like, we've had available tests, whereas other hospitals in like Phoenix and other places have basically like run out of tests. We've been really fortunate. Like in Vegas, like very few people are getting tested in Vegas. So even though it's frustrating that you can't have a test every time you want one, we actually were fortunate to have a couple of different ways to test here, and we're able to. We've basically been able to continue to provide care in a way that hasn't really disrupted our model too much.
There's a lot of staff that work in the laboratory that we're kind of all behind the scenes, and people, really not seen amongst the hospital employees. But we have a great staff who have worked really hard doing the COVID testing, bringing this testing online, and sometimes they're forgotten. But we just want to say thank you to our laboratory staff for doing such a fantastic job.
Thank you for watching our COVID-19 update series. For more information, visit our website at azkrmc.com/COVID-19 and follow us on Facebook at Kingman Regional Medical Center. I'm Julia Walters with Kingman Regional Medical Center. Until next time, stay safe and healthy.